I mean, I suppose the key thing for us is when we're working alongside people with learning disabilities is to gauge as much information as we can so that we can fit them more than they fit our service.
People with learning disabilities experience health inequalities, so they don't have the same level of health that their mainstream counterparts do.
The HEF it makes you look in depth at a person's health, and it makes you question the things that most of us take for granted.
So the HEF was developed in order to identify those health inequalities, and then for professionals to be able to look at those and work out how they might be able to overcome some of them.
So initially we did a HEF assessment for each person that comes into the service.
And we can compare the data to ensure that what we've done and the changes that we've made have improved that person's quality of life.
So some of the key elements that we've looked at with the HEF have been around service equality, communication and social aspects. So it's looked more into depth of how somebody's supported, not just within our services, but within the community and at home.
People weren't accessing the dentist on a regular basis. People weren't having their equipment service. So therefore it helped us to educate families and carers and support staff about what should be the norm for people.
The key to making the HEF a useful tool is actually doing something with that information.
Having that historical data as well as that up-to-date data helps you to understand the individual much better.
So one of the reasons we decided to use Lincus alongside HEF is that HEF gives you a snapshot at a particular time of someone's health inequalities. Lincus enables you to tell the story and track those events and interventions.
It makes you ask the questions which sometimes you can overlook because you think it's an obvious question.
Lincus asks people things like if they're thirsty, are they hungry, what events are they doing, do they like those events? Just because somebody has gone bowling every week for the past 10 years doesn't mean they like going bowling.
It's them having that, I can do this is how I'm feeling, they feel listened to.
Now I'm feeling amazing.
Amazing? Using these tools, one, because I think they did bring something new, but also just asking everybody to think about how we're supporting people.
Lincus has enabled us to perhaps change individual support, so because we've found out more about them, things that upset them or that they particularly like.
Do you feel like you have control of your life?
Yes.
For me, this project has been about improving our support in a number of ways.
In Gloucestershire, we picked a population of people who were about to experience a big house move.
Sort of just over 50 of the people we support here were living at two large, rural and quite isolated campus sites. They've been residential services for 50 plus years.
Where we were, it was in the middle of nowhere where there was one bus a week.
So it's very, very difficult to have regular, meaningful community access.
And that's not a suitable environment for somebody who has barriers to their everyday life already.
So people moved into smaller properties. They've had choice in where they live, they've had choice in the type of house they live, they've had choice with who they live with.
I think we've had an awful lot to manage in Gloucestershire at the same time, so Lincus and HEF would be one of a number of substantial changes.
The biggest success in Gloucestershire was the fact that we were able to overcome a few challenges.
It's about building on the lessons that we've learned, and it's about increasing their ownership of their lives.
People that attend Piccadilly have got really complex health needs, so we need to ensure that every need is met, so we know what pain levels, what that looks like for an individual.
Mother, brother, sister, uncle, auntie, whoever has daily contact with that person, and we gather that information that they have.
With the day service particularly, I think one of the things that came out of it was, where does the day service start and end? On paper it starts at 9 in the morning and it ends at 5 o'clock in the evening, Monday to Friday.
When we do reviews with people, one of the key things we will ask is, are all the health needs being met? How often do you visit the dentist? What we haven't been asking for in the past is, when did you last visit these places?
But actually what the team were realising was that things that perhaps weren't the responsibility of a day service, so regular dental checks, regular hearing checks, weren't happening.
We need really, really strong links between healthcare and social care. This service wouldn't run properly if we didn't have those strong links, because you wouldn't have an understanding of the whole person.
I think what this project has highlighted for us is that you can't just consider one without the other.
It means, there's no division between health and social, is there? You can't have a social life if you're not in your optimum health. And if someone's laughing and joking and having a laugh when we played bingo last week, then that means for me is they're not in pain, they're not suffering, they're not, it tells me a lot, doesn't it, just by watching somebody.